The blood hit the wall before anyone moved. A arterial spray, bright, violent, unmistakable. And the trauma room at Harwick Regional Medical Center in Tucson went completely still. 12 medical professionals stood frozen around a gurney, carrying a man whose neck was torn open in a way that defied description. Military escort, tactical gear, radios crackling, and a wound that was eating seconds like they were nothing. The chief surgeon took one look and stepped back. Not forward, back. Then a woman nobody respected pushed through the crowd, snapped on gloves, and said 2 words. Move, now. What happened next wasn't something taught in nursing school. It wasn't in any civilian protocol. It was a battlefield procedure, precise, brutal, effective, performed by a 31-year-old nurse everyone in that hospital had spent months treating like she was barely smart enough to take a blood pressure reading. Her name was Hannah Brooks, and she was about to become the most dangerous person in that room. Before you go any further, if this story already has you leaning forward, follow along and stay until the end. Drop a like and leave a comment telling me what city you're watching from. I love seeing how far these stories travel. Now let's get into it. The day Hannah Brooks started at Harwick Regional, she arrived 7 minutes early, found her locker, changed into scrubs, and spent the first hour being told by 3 different people that she was in the wrong department. Float pools on the 2nd floor, said the charge nurse, a compact woman named Deborah Osei, without looking up from her clipboard. I'm assigned to trauma, Hannah said. Deborah looked up then. Took her in. The plain face, the unremarkable build, the quiet way she stood without filling the room. Who signed off on that? Dr. Whitmore. I have the paperwork. A pause. Deborah made a sound that wasn't quite a laugh. Fine. Try not to get in anyone's way. That was September. By November, Hannah had learned the geography of being invisible in a busy hospital. She took the assignments no one wanted. The graveyard shifts, the overflow patients, the combative drunks, the slow nights where nothing happened, and the fast nights where everything happened at once. She was efficient without being flashy. She documented everything. She never complained, not once, even when Dr. Marcus Holt, one of the senior ER physicians, told a resident in front of her loud enough that 3 nurses turned to look that the blonde one needed to be supervised more closely because she seemed a little slow on the uptake. She let it go. She was good at letting things go. She'd had practice. What nobody at Harwick Regional knew, what she'd worked very carefully to make sure nobody knew, was that before she'd ever set foot in a civilian hospital, Hannah Brooks had spent 6 years as a combat medic with the 75th Ranger Regiment. 2 deployments to Afghanistan, 1 to Syria. She'd kept soldiers alive in conditions that would have broken most people's minds. She'd performed field amputations, chest decompressions, and emergency surgical interventions in places with no electricity, no sterile field, and people actively trying to kill her while she worked. She didn't talk about it. She'd learned the hard way that talking about it made things worse. The paperwork said she left the military following a general discharge. The paperwork didn't say why. And Hannah Brooks had decided when she moved to Tucson and took the job at Harwick that the paperwork was all anyone was going to get. She kept her head down. She did the work. She ignored Deborah's sighs and Marcus Holt's condescension and the way the ER staff talked around her like she was furniture. She told herself it was temporary, that she was just rebuilding, just getting her footing, and most days she almost believed it. Then they brought in Commander Daniel Pierce. It was a Tuesday, 11:47 p.m., when the double doors blew open and the military escort came through. Hannah was at the nurses' station charting when she heard the radio traffic first. Clipped, terse, the cadence she recognized before she consciously processed it. Military. She was on her feet before the gurney rounded the corner. 3 soldiers in tactical gear, 2 federal agents in suits already on phones. And on the gurney, a man in his mid-50s, unconscious, in shredded civilian clothes that had been cut away to expose a wound that made the intake nurse physically flinch. The neck. Right lateral. Something, shrapnel she'd guess, based on the pattern, had torn through at an angle that missed the carotid by millimeters, but had caught the external jugular and done serious work on the surrounding tissue. He was bleeding in a controlled way, which meant something had been packed into it. Field dressing, she could see the gauze, but the packing was failing. The gauze was saturated, His pressure was crashing. Dr. Holt was on tonight. He came in fast, looked at the wound, and his pace slowed. She saw it happen. The moment a doctor's confidence outran his actual experience and then reversed itself. Holt had trained in a level 1 trauma center in Chicago. He'd seen gunshots, stabbings, car accidents. He had not seen this. "Get me a vascular surgeon," he said, stepping back half a step. "Page Dr. Okonkwo. He's on call." "He's 20 minutes out," the charge nurse said. "Then we stabilize and wait." Hannah looked at the man on the gurney. His lips were going gray. His oxygen saturation was dropping on the monitor. 20 minutes was a number that meant something very specific right now, and that specific thing was not survivable. She moved to the gurney before she made the decision to move. "I need a bougie, a size 7 crick kit, and a vascular clamp," she said. Her voice came out flat and certain, the way it always had in the field. "And somebody needs to repack that wound right now." The room turned to look at her. Holt stared. "Excuse me?" "The packing is failing. He's going to lose pressure completely in about 4 minutes, and then we're not going to have options." She already had gloves on. She didn't remember putting them on. "I can stop the bleed if someone hands me the clamp." "You're a nurse," Holt said. The word landed like a door slamming. "You're not qualified to move." It wasn't loud. It wasn't aggressive. It was the voice of someone who'd said the same word in worse places and had people obey because the alternative was watching someone die. The word had a texture to it. Not anger, not desperation, just certainty. And something in that texture made the nearest scrub tech take a half step back. Hannah stepped into the space. What she did next took 4 minutes and 30 seconds. She would know, because she was counting. She located the bleeding vessel by feel through the wound, got the clamp on it with a precision that made the circulating nurse make a quiet sound of surprise, repacked the wound with pressure and technique, and then called out orders for fluids and blood products in a sequence that was correct, efficient, and exactly what the man needed. Commander Daniel Pierce's blood pressure stabilized. His oxygen saturation began to climb. The trauma room was completely silent. Dr. Holt hadn't moved. He was standing 2 feet back, and on his face was an expression Hannah recognized. She'd seen it on officers who'd underestimated a situation and then had to reckon with that mistake. It was the specific look of a man recalculating everything he thought he knew. One of the military escorts, a young sergeant, his name tape said Kowalski, was staring at her with something that wasn't surprise anymore. It was recognition. "Ma'am," he said quietly, while the rest of the room started moving again. "Where'd you learn that?" Hannah stripped off the bloody gloves. "I read a lot," she said, and went back to the nurse's station to finish her charting. "Outside." Deborah Osei found her 20 minutes later. "Dr. Holt wants to speak with you." "I'm sure he does." "Hannah." Deborah's voice had changed. Something in it had shifted, and it took Hannah a moment to identify what. It was respect, reluctant and grudging, but real. "What you did in there was what needed to be done. You should have called for authorization before you—" "He'd have been dead before I got authorization." Hannah closed her chart. "If Dr. Holt wants to write me up, that's his right. I'll take the meeting." Deborah looked at her for a long moment. "He's not writing you up," she said finally. I don't know what he is, but he wants to talk." The conversation with Holt happened in a supply corridor, which was the closest thing the ER had to privacy at midnight. He was a tall man, mid-40s, and he had the posture of someone accustomed to being the most competent person in a room, which meant that right now he was deeply uncomfortable. "Where did you train?" he asked. "University of Arizona, BSN program." "That's not a nursing school technique." She said nothing. "That clamp placement, the way you located the vessel, that's surgical. That's beyond surgical. He trailed off. "Where were you before you came here?" "My file's on record with HR," she said. "If there's a formal process you need to—" "I'm not being formal. I'm asking you a direct question." She looked at him. He was genuinely bewildered. Not angry, not defensive, just confronted with a reality he hadn't prepared for. And Hannah, for the first time in months, felt something loosen slightly in her chest. Not enough to be dangerous, just enough to be noticeable. "I've worked in high-pressure environments," she said carefully. "I know what to do when the options run out." Holt studied her. "The patient. He's asking for you." That stopped her. What? The commander. He's conscious. He's asking who saved him. Holt paused. I told him it was you. He asked your name. Holt hesitated and something moved behind his eyes. He had a reaction to it. Your name. Like he recognized it. The thing that had loosened in Hannah's chest suddenly pulled tight. She said, carefully, I've never met him. He seems to think differently. She didn't go to the commander's room that night. She told herself it was because she needed to finish her shift, which was true. She told herself it was because there were federal agents stationed outside his room, and she didn't have clearance, which was also true. She told herself it had nothing to do with the fact that the name Pierce had surfaced in her memory attached to things she'd spent 4 years burying. In 2019, when Hannah was deployed to eastern Afghanistan with the Special Operations Task Force, there had been a mission, classified. 8 soldiers, a compound outside a village called Mirabad that shouldn't have had any armed presence according to the intelligence they'd been given. The intelligence had been wrong, or the intelligence had been deliberately misleading. Hannah had flagged the discrepancy in the pre-mission medical brief, had told her commanding officer 3 separate times in writing that the casualty projections didn't account for the level of opposition that field reports were suggesting. She'd been told to focus on her job and stop second-guessing the intel. 8 soldiers died. 3 more were critically wounded. Hannah had worked for 6 hours straight in a crumbling building under fire, doing the job that everyone later said she hadn't done properly. When the investigation came, her warnings had disappeared from the record. The reports she'd filed didn't exist, and the story that emerged, carefully constructed, internally consistent, was that a junior combat medic had failed to prepare adequate triage resources for a mission she'd been fully briefed on. The discharge that followed was not honorable. The word used was administrative. Hannah had taken it without fighting back, because the people she would have had to fight were the same people who'd made the warnings disappear. And she was 27 years old and exhausted and didn't know yet what she knew now. That she'd made a mistake, not in the field, but in not recording everything, everywhere, in ways they couldn't reach. The name Daniel Pierce had been in the investigation documents, not as an accused party, as a witness, a commander who'd been present in the region during the operation. She'd thought about him over the years, wondered what he knew, wondered if he'd been told what to say. She told herself this was coincidence. She'd been telling herself things were coincidence for 4 years, and she was getting worse at believing it. By Thursday morning, the hospital had 2 things it hadn't had on Monday: a military patient surrounded by federal agents, and a story spreading through the staff about a trauma nurse who'd performed something nobody could quite explain. Hannah arrived for her shift and could feel it, the way people were looking at her differently. Not warmly. Something more complicated than warmth. People who'd ignored her for months suddenly found reasons to be near the nurses' station when she was charting. She overheard 2 residents replaying what they'd seen in a hallway, their voices low and uncertain. Even Deborah Osei had stopped sighing at her. She didn't trust any of it. At 9 a.m., one of the federal agents, a woman in her 40s with gray at her temples and the specific economy of movement that Hannah associated with people who'd spent time in operational environments, appeared at the nurses' station and asked politely, but without any real suggestion that she was giving Hannah a choice, if Hannah could spare a few minutes. Her name was Rebecca Lawson. She showed a badge that said FBI. "I'm told you're the one who stabilized Commander Pierce," she said, once they were in a conference room with the door closed. "I assisted in his care," Hannah said. Lawson looked at her with an expression that suggested she didn't have patience for technical qualifications. "I've seen the chart. I've spoken with Dr. Holt. You didn't assist. You ran the intervention." A pause. "Where'd you train?" Hannah was beginning to find the question tiresome. "Nursing school, as it says in my file." "And before that?" She said nothing. Lawson leaned back in her chair. "Hannah, I'm going to tell you something because I think you're someone who'd rather have real information than comfortable ambiguity." She set a folder on the table. "Commander Pierce was attacked. The vehicle he was traveling in was hit with a shaped charge 3 miles from this hospital. The 2 agents escorting him are dead. The driver is in intensive care. Pierce survived because someone in that vehicle applied field dressing with enough skill to keep him alive for the 12 minutes it took to get him here. Hannah looked at the folder without touching it. The dressing was military technique, Lawson said, not just trained military, specifically the layer sequence, the pack method. It's a Ranger-specific protocol. We've had it confirmed by 3 people. The room was quiet. I'm not here to cause problems for you, Lawson said, and her voice had moderated into something that was almost careful. I need to understand what I'm dealing with. The commander is asking for you by name. He was conscious in the vehicle. We're not sure yet if he applied his own dressing or... She stopped. Did you treat him before he arrived at this hospital? No, Hannah said. I was here all night. Check the logs. Lawson nodded slowly, like she'd expected that answer. He knows your name, Hannah. People know my name. He knew it the way you know someone from before. Lawson tapped the folder. I've had some time this morning to make some calls. There's a gap in your employment history between 2013 and 2019 that your nursing school application attributes to other professional experience. A beat. I'd like to know what that experience was. Hannah looked at her for a long moment. She'd been careful. She'd been so careful. New city, new name on the paperwork using her real name but giving nothing away. References that were real but strategically chosen. A history that was technically accurate and comprehensively incomplete. She hadn't counted on the right person asking the right question. Am I being detained? She asked. Lawson shook her head. You're free to go. I'm asking as a courtesy. Then I'll think about it, Hannah said and stood up. She'd made it to the door when Lawson spoke again. The commander told me to tell you something. He said you'd know what it meant. A pause. He said, Mirabad, 2019. Hannah's hand was on the door handle. She didn't turn around. I don't know what that means, she said. The word was a lie. The flatness of her voice was not. Whoa. She spent the rest of her shift in a state of controlled functioning that she recognized from the field. The mental discipline of performing necessary tasks with precision, while a separate part of your brain worked a different problem. She drew blood, adjusted medications, responded to call lights, documented everything correctly. Her hands were steady. Her face gave nothing away. Inside, Mirabad, the name of a village in eastern Afghanistan that she hadn't said out loud in 4 years. The name of a mission that had been scrubbed from her record like it had never happened. The name of the worst night of her life. If Pierce knew that name, if he'd said it, specifically to Lawson, specifically to pass it to Hannah, then one of 2 things was true. Either he was the person who'd buried her, using the name to demonstrate that he still had leverage over her, or he was someone who knew the truth and had decided, for reasons she couldn't yet read, that now was the time to surface it. She couldn't afford to assume which one. At 2 p.m., her charge nurse came to find her. Not Deborah this time. The day shift supervisor, a man named Al Terranova who'd been at Harwick for 15 years and had the weathered competence of someone who'd seen everything. He looked uncomfortable in a way that Al Terranova never looked uncomfortable. HR wants to see you, he said. She looked at him. Now? I'm sorry, Hannah. They said now. The HR office was on the 3rd floor. The woman who ran it, Sandra Keel, mid-50s, perpetually overscheduled, was sitting behind her desk when Hannah came in, and there was another person in the room who Hannah hadn't expected, a man she recognized as the hospital's chief operating officer. She'd seen him once at a staff meeting. His name was Garrett Sims. Sit down, Sandra said. Hannah sat. We've had a concern raised, Sandra said. She had a file in front of her, and she was looking at it rather than at Hannah, which told Hannah something. About clinical practice. Regarding Tuesday night? Regarding unauthorized medical interventions. Sandra's voice was carefully neutral. Dr. Holt has submitted documentation indicating that a nursing staff member performed procedures outside the scope of nursing licensure during an emergency. Hannah looked at her steadily. Dr. Holt stepped back. The patient was crashing. I intervened. You performed a vascular procedure, Sims said. His voice was flatter than Sandra's, less careful. Without physician supervision, without authorization, in a situation that involved federal law enforcement personnel and a patient whose case is sensitive. The patient would be dead. That's not the point. She looked at him. Then what's the point? Sims glanced at Sandra. Something passed between them, a decision that had already been made before she walked in. The hospital has an obligation to ensure that all clinical staff are operating within credentialed and authorized scope of practice. In light of this incident, we're placing you on administrative leave pending a review. Hannah sat with this for a moment. Administrative. There was that word again, following her like a dog. Pending a review, she said. How long? As long as the review requires. She looked at the file Sandra hadn't opened. She knew what was in it, or what was going to be put in it. The documentation of an incident, constructed in a particular way to support a particular conclusion. She'd seen this before. She knew exactly how it worked. I need to return my badge, she said. Yes, Sandra said. Security will escort you. The walk to the locker room, badge surrendered, personal items retrieved. It took 9 minutes. Security was a young man who looked genuinely apologetic about his job, and she didn't make it hard for him. She changed out of her scrubs. She put on the civilian clothes she'd come in with, jeans, a gray pullover, boots, and she stood for a moment in front of her empty locker. 8 years of building a life after the worst thing that had ever happened to her, and someone had found her. She didn't know yet if that was catastrophic or the first step toward something else. She closed the locker and walked out. Oi! The parking garage was on the west side of the building, 3 levels. Her car was on the second. She was almost to the stairwell when she heard it. A sound that wasn't the hospital, wasn't the city, wasn't anything she'd have registered 6 years ago before Afghanistan taught her to hear things differently. Movement. Behind a concrete pillar, 30 feet back. Controlled, deliberate. She kept walking. A car door, not opening, someone using it as cover. She'd done it herself 100 times. Her pulse didn't change. She noted the position, the angle, the fact that she hadn't seen any security cameras in the last 10 seconds because the one on the east wall was pointed slightly wrong, which wasn't an accident. She reached her car, took out her keys. And in the window's reflection, it was dirty glass, barely a reflection, but enough. She saw 2 of them, both men. Civilian clothes, wrong build for civilians. The posture, the positioning, the way they were moving on angles rather than straight lines, these were trained people. She didn't know their purpose yet. She knew they weren't hospital staff, and they weren't cops, and they'd been waiting for her. She unlocked the car, got in, started the engine. The direct route out of the garage was the ramp on the south side. She took the north exit instead, the one that came out on the service road, and she watched the mirror the entire way. One of the men was moving toward a black SUV parked near the elevator, fast now, no longer pretending. She pulled onto the service road and made herself drive at a normal speed, and her mind was very calm in the way it only got when a situation was bad enough that panic was no longer an available option. Someone had been waiting for her in the hospital's parking garage. That meant someone had known she was going to be removed from the building, and that meant whatever was happening. Pierce, Mirabad, the federal agents, the shaped charge that had killed 2 people 3 miles from here was closer to her than she'd understood. Her phone buzzed on the seat. Unknown number. She answered it. A man's voice, not one she recognized. Don't go home, Ms. Brooks. A pause. Your apartment is already compromised. I know that's not what you want to hear. Another pause. My name is Pierce. We need to talk. I'm not who you think I am. The black SUV was 2 cars back in her mirror. She pressed the accelerator and thought, 4 years of staying invisible. Apparently that's over. She drove east because east was away from her apartment and away from the direction the SUV had been angling, and she needed 30 seconds to think before she made any decision that mattered. The phone was still in her hand. Pierce's voice had cut out after those last words. I'm not who you think I am. And the line had gone to silence. Not dead air, but actual silence. The kind that meant someone was waiting on the other end. How did you get this number? She said. Not a question, a test. Same way I found out where you were working. A pause. She could hear background noise, mechanical, low, not a hospital room. You covered your tracks well. Most people wouldn't have found you, but I've had 4 years to look. Then you have about 4 seconds to say something that gives me a reason not to hang up. Mirabad wasn't your fault. His voice was rough, medicated at the edges, the way a man sounds when he's on the wrong side of pain management. I know that because I was the one who pulled your warnings from the file. The black SUV had taken the turn she'd expected, south toward the main road. She was on a surface street heading toward the freeway, and the traffic was dense enough that she could make distance if she needed to. She made herself breathe. Keep talking. I need you to come to me, not the hospital. They've moved me. There's a location I'm going to text you in approximately 2 minutes. Come alone. Don't tell Lawson. And if you see anyone following you, abort and call the number back. He stopped. She could hear him adjusting something. Position, she guessed. A man who'd had his neck torn open 48 hours ago, trying to sit up in whatever room they'd put him in. I know I'm asking you to trust someone who gave you every reason not to. I understand if you don't come. The text arrived. An address in the Midtown District, a medical annex attached to a VA facility. Somewhere with legitimate foot traffic and legitimate security, which was either a reassurance or a very good setup. She thought about the men in the parking garage. She thought about the word Mirabad delivered through an FBI agent like a key. She thought about 8 years of keeping her head down and the last 4 days proving that it hadn't been enough. 2 hours, she said. If anything feels wrong, I'm gone. She disconnected and drove. She stopped at a pharmacy first, bought a burner phone with cash, transferred the contact information, and left her primary phone in a parking lot 2 miles from the VA annex. If anyone was tracking it, they'd spend the next several hours looking at a Walgreens. The annex was a low building behind the main VA campus, and there were 2 men stationed outside who weren't wearing uniforms, but were standing in positions that weren't casual. She recognized the stance. She'd used it herself. They let her through without stopping her, which meant Pierce had given her description, which meant he'd been confident she'd come. She didn't love that he'd been right. The room they'd set him up in was sparse, not a standard hospital room, more like a facility that had been repurposed quickly. A bed, monitoring equipment, 2 chairs, and a window with the blinds pulled. Pierce was sitting up when she came in, which told her more about his pain tolerance than she wanted to know because she'd seen the wound, and sitting up should not have been something he was doing. He was older than she'd expected. Mid-50s, gray at the temples, with a face that had the particular weathering of someone who'd spent years in places with hard sun. The kind of man who looked like he'd been handsome once and traded it in for something more durable. There was a file folder on the bed next to him. "You came," he said. "You said you pulled my warnings from the file." "Sit down." "I'm fine standing." He looked at her for a moment with an expression she couldn't read. "Fair enough," he said. Then, "In 2019, I was a colonel attached to a joint Special Operations Command task force running operations out of Kandahar. I wasn't on the Mirabad mission, but I was in the chain of command that approved the intelligence package." "I know," she said. "Your name was in the investigation report." "As a witness, that's correct." He shifted, and she saw the wince he tried to suppress, the neck wound, the pull of whatever they'd sutured. What the report didn't include was my original objection to the intelligence package. I'd flagged the same source your warnings were based on, the same field reports suggesting a significant armed presence in that compound. I was overruled. He paused. 3 days before the mission, I received a direct communication from a 2-star general. He told me the intelligence was sound, that my concerns were duly noted, and that if I raised them again through official channels, my career would be over. Hannah was looking at the file folder. "I made a choice," Pierce said. "I stopped pushing. I told myself the general knew something I didn't, that the 2-star intelligence apparatus had better information than a colonel in Kandahar." He stopped. 8 soldiers died. 3 more came home with injuries they'll carry for the rest of their lives. And a 27-year-old combat medic had her career destroyed because she was right, and we needed someone to blame. The room was very quiet. "You said you pulled my warnings from the file." "Yes." "Why?" He looked at the window. "Because a general told me to." The honest awfulness of that answer was something she hadn't prepared for. She'd expected justification, self-defense, some architecture of explanation that softened what he'd done. Instead, he just said it. "Because a general told me to." with the flat delivery of a man who'd been carrying the weight of it for 4 years and wasn't interested in making it lighter. "His name is Victor Mercer," Pierce said. "He was a brigadier then. He's a 2-star now. He runs a Pentagon-adjacent advisory structure with defense contracting connections that go deeper than anything I understood in 2019. He picked up the file folder and held it out to her. "I've spent 4 years building this. Every record I could access, every communication I could reconstruct, every financial connection I could document. The Mirabad mission wasn't an intelligence failure. It was deliberate." She crossed the room and took the folder. She didn't open it yet. Deliberate how? The compound at Mirabad housed a weapons cache that Mercer's contracting network had arranged to sell to a regional warlord. The mission, officially a high-value target capture, was designed to fail. The soldiers who died weren't casualties. They were collateral damage on a transaction. He stopped, and the intelligence package was constructed to make the failure look like a tactical error rather than what it actually was. Hannah opened the folder. The first page was a communication log, dates, routing codes, partial message content. She didn't recognize most of the identifiers, but she recognized the formatting. She'd spent 6 years reading military communications. "You've had this for 4 years," she said. "I've been building it for 4 years. There's a difference." He looked tired in a way that had nothing to do with the wound. "I couldn't go to the IG office. Mercer has connections there. I couldn't go to Congress. The relevant committee chairs received defense contractor contributions that map directly to Mercer's network. I've been looking for someone I could trust who is also someone Mercer would underestimate." She looked up from the folder. "He thinks you're a disgraced former medic working a night shift in Tucson," Pierce said. "He's been watching you. Not closely, because he didn't think you mattered. But when I started making moves 6 months ago, trying to get this documentation to the right federal structure, he started watching people who'd been connected to Mirabad, including you." "The parking garage," she said. "He knows you're in contact with me now, which means the timeline just compressed significantly." He met her eyes. "Lawson is clean. I need you to trust that." "Why should I trust your judgment on anything?" "You probably shouldn't," he said. "But she's the one who came to me when I was flagging Mercer's network to a back-channel FBI contact. She's been building the legal case. What I have is evidence. What she has is jurisdiction." He paused. "What we need is a witness who was there, who knows what was suppressed, and who has every reason to tell the truth." Hannah closed the folder. She held it in both hands and looked at the man who'd made a choice 6 years ago that had cost her everything she'd built. And she thought about what it meant that he was asking her to step back into the thing she'd spent 4 years running from. "I need to think," she said. "I know." He didn't push it. "There's a secure protocol. Lawson will walk you through it. If you decide to cooperate, there's a process for formal witness protection while the investigation—" A sound. Not in the room. Outside. A sound she knew. Not an alarm. Not footsteps. Something mechanical and wrong. The kind of sound that preceded something worse. Pierce heard it too. She saw his face change. She was at the window before she decided to be at the window, angling to see through the slats without showing herself. And what she saw in the parking lot made her step back and think very clearly and quickly about what options she had. 3 vehicles. Black, government-plated, which meant nothing. Government plates were easy. But the personnel exiting them weren't moving like federal agents on an authorized operation. They were moving like people who were done pretending. "Call Lawson," she said, right now." "What?" "Call her. Tell her the annex is compromised. Tell her how many vehicles you count from the other windows." She was already at the door, opening it half an inch to look at the corridor. The 2 men who'd been stationed outside were gone. Not standing down. Gone, which was worse. "Do you have a phone?" "Yes, but—" "Call her." She turned back to him. "Can you walk?" Pierce looked at her with something that might have been desperation at the edges. "Not fast." "Fast enough for a stairwell?" A breath. "Yes." "Then we're going now." The next 11 minutes were not smooth. They were not the kind of thing that looks clean in retrospect. Pierce could walk, but his gait was wrong. The neck wound had affected something in his equilibrium, and he listed slightly right on stairs. and Hannah had to make the ongoing calculation between moving quickly and keeping him upright because an unconscious man in a stairwell was not a problem she could solve. They made it to the basement level, which had a service corridor that opened onto a loading dock on the east side of the building. She could hear voices above them, multiple floors coordinated, and the building's emergency intercom had gone silent, which wasn't a system failure. "Did you reach Lawson?" she asked, not stopping. "She picked up. She said to get out of the building. She has a team 12 minutes out." 12 minutes. She didn't say what she thought about 12 minutes. The loading dock was clear. She got the door open, kept Pierce behind her, scanned the approach. 2 dumpsters, a delivery van with the engine off, chain link fence along the perimeter. No movement. They made it to the fence. There was a gate, padlocked. She looked at the lock. Old hardware, a standard shackle, and looked at Pierce, who reached into his pocket and produced a multi-tool with the unhurried competence of a man who'd been in bad places before. He got the lock in 40 seconds. She revised her assessment of him slightly. On the other side of the fence was a service road, and on the service road was a gray sedan that hadn't been there when she arrived. The driver's window came down and Rebecca Lawson looked out, and the expression on her face said that 12 minutes had been a significant understatement. "Get in," Lawson said. Hannah got in. Pierce got in. The car was moving before the door was closed. "How did they find the annex?" Hannah said. "They had someone inside the VA facility. We're working on that." Lawson's eyes were on the mirror. "Are you hurt?" "No." "Commander?" "I'm functional," Pierce said, which Hannah noted was not the same as fine or okay. Lawson made 2 turns in quick succession, heading toward the freeway. "I need to take you both to a secure location, not federal, private, vetted, off any network that Mercer's people can access. Once we're there, I need formal statements, both of you." "Pierce gave me a file," Hannah said. "I know. We have corroborating documentation from 2 other sources. What we don't have is a first-hand account from someone who was present at Mirabad and can testify to what they filed, what they saw suppressed, and the chain of command responsible." She glanced in the rearview mirror, at them. Not at Hannah, at the road behind them. "What we need is you, Hannah." Hannah looked out the window at Tucson moving past, the streets she'd learned over 8 months, the coffee shop she went to on Thursday mornings, the intersection near her apartment complex where a traffic light had been broken since October. A city she'd chosen because it was anonymous and warm and far from everything that had gone wrong. She'd built something here, something small and careful. And someone had followed her anyway, because the past wasn't a place you could leave if you were inconvenient enough to other people's plans. She thought about 8 soldiers. She thought about a file folder full of communications logs and financial records that a man had spent 4 years assembling because he'd made a choice that had destroyed her and hadn't been able to live with it cleanly. She thought about the word administrative and the way it had followed her like a shadow across 8 years. "What does testifying look like?" she said. "Right now? A formal recorded statement to federal investigators. Later, depending on how the prosecution builds, possibly a grand jury." Lawson's voice was careful. "I won't minimize the exposure. If Mercer's network is as extensive as the documentation suggests, the people you'll be testifying against will have resources and motivation to—" "I know what it looks like," Hannah said. "I've been on the wrong side of one of these before." Lawson nodded. "Then you know how important it is to get it right." The freeway entrance was ahead. Lawson merged and accelerated, and for a few miles there was nothing but traffic and movement and Hannah's own thoughts, which were not quiet. It was Pierce who spoke first. His voice from the back seat was rough and quiet. "I know there's nothing I can say about what I did. I know that. But I want you to know that I came forward because I finally found a way to actually do something, not because of—" He stopped. "It's not absolution. I'm not asking for it." She didn't answer him. She didn't have an answer that was both honest and kind, and she'd stopped choosing kind when the situation didn't deserve it. The safe location was a house in the suburbs north of the city, a property that had apparently been used before for federal witness purposes and had the particular blandness of somewhere designed to be unrememberable. 2 federal marshals on site, a secure communications setup, food that tasted like it had come from a catering service operating on the lowest possible budget. They spent 6 hours in formal session with Lawson and a prosecutor from the U.S. Attorney's Office named Tomas Reyes, who had the focused intensity of someone who'd been working a case for a long time and could see it getting close to resolution. Hannah gave her account from the beginning, the pre-mission briefs, the flagged intelligence, the 3 written communications she'd submitted, the night of the mission itself, and the investigation that followed where everything she'd documented had ceased to exist on paper. Reyes recorded everything. He asked precise questions. He didn't editorialize and he didn't offer reassurance, which Hannah respected. At the end, he closed his laptop and looked at her across the table. "I want to be direct with you about where we are. The documentation Commander Pierce has provided, combined with your testimony and 2 additional corroborating witnesses, is enough to support federal indictments on multiple counts: conspiracy, financial fraud, and potentially murder for the Mirabad deaths if we can establish intent beyond the current evidence." He paused. "The challenge is that Mercer is not a careless man. He's going to know we're building this. He's going to move to interfere with the case, and based on what happened today at the annex, he's already moving." "What does interfering look like, Yeb?" Hannah asked. "Witnesses disappearing, evidence getting challenged on chain of custody grounds, delays through legal channels that outlast the political appetite to prosecute a decorated 2-star. Reyes looked at her steadily. "The best protection you have is speed. The faster we can get to indictment, the harder it becomes to dismantle. And until then, this house." He glanced toward the window, then back. "I'm sorry. I know that's not—" "It's fine," she said. It wasn't fine, but fine was beside the point. She went to sleep in a bedroom that smelled like government-issue linen and lay on her back in the dark, thinking about the file folder, which Reyes had taken, but not before she'd read enough of it to understand the shape of what Mercer had built. The financial architecture was elegant, in the way that genuinely corrupt systems sometimes were. Multiple layers of contractor shell companies, defense procurement diversions, the kind of careful construction that assumed it would never be looked at by the right people. Mercer had assumed wrong, but elegant corrupt systems had a particular vulnerability, and she'd spotted it in the documentation and hadn't said anything to Reyes yet because she was still deciding if she trusted the process enough to hand it over. There was a financial routing record in the file, a payment sequence that ran through a procurement contractor called Brigg Wallace Defense Solutions, and the terminal account on that sequence wasn't a shell company. It was a real institution, which meant there was a real paper trail that led to a real place, and if Mercer's people didn't know it was in Pierce's documentation, it was the most valuable single piece of evidence in the folder. She stared at the ceiling. Her phone, the burner, buzzed. Unknown number, different from Pierce's. She almost didn't answer it. She lay there in the dark holding the phone while it buzzed a second time. And then she answered because not knowing who was calling was worse than knowing. The voice on the other end was one she'd never heard before. Male, educated, calm in the specific way of someone who decided the outcome of a situation before they picked up the phone. "Ms. Brooks," the voice said, "I want to give you the opportunity to make a sensible decision before things become significantly more complicated." A pause. "My name isn't important. What's important is that the statement you provided tonight will be very difficult to use in any proceeding without corroboration. The corroboration you think you have is more fragile than you've been led to believe." She said nothing. "I want you to understand something clearly." The voice was pleasant. That was the disturbing part. It was the voice of someone making a reasonable offer, not a threat. "The people protecting you right now are federal agents operating on the assumption that their case will reach indictment before the relevant political circumstances change. That assumption has a shorter shelf life than they've told you." Still nothing from her. "There's an offer on the table," the voice said. "A settlement. All proceedings against you. Your military discharge, the administrative record, permanently expunged. A financial settlement of $250,000. In exchange for your withdrawal from the investigation, an assigned statement clarifying that your testimony was given under duress and does not reflect a reliable account of events." Hannah looked at the ceiling. $250,000. Her military record cleared. The thing she'd wanted for 4 years, handed to her in the middle of the night by a voice on a phone that wasn't supposed to have her number. "I'm going to need to think about it," she said. "Of course. You have until 6 a.m. The voice paused. Ms. Brooks, I want to emphasize that this offer is generous and that it has a hard expiration. After 6 a.m., the nature of the conversation changes. The line went dead. She put the phone down on her chest and stared at the ceiling of a government safe house in the suburbs of Tucson and listened to the sound of the building around her. The marshal outside the door, the distant traffic, someone's television in another room. The nature of the conversation changes. She knew exactly what that meant. She'd heard variations of it before, in different contexts from different people who all believed they were the first person to try this particular approach on her. What she hadn't expected was that they'd had her burner number, the burner that Pierce had texted her on, the burner she'd bought with cash at a pharmacy 2 hours before going to the annex, which meant one of two things. Either the phone network itself had been compromised in a way that required significant resources, or someone inside the current operation, the federal team, the safe house network, the small circle of people who knew where she was tonight, had passed her number to Mercer's people. She sat up in the dark. There's someone inside. The realization arrived not as panic, but as the cold, practical clarity she'd learned to recognize as her brain operating correctly under pressure. She thought about who'd known about the burner. Pierce, Lawson, Reyes, the two marshals, whatever support staff had arranged the safe house. She thought about the annex, how they'd found it, how fast they'd moved. 12 minutes. Lawson had said 12 minutes for a response team, but the threat had arrived first. She thought about the file folder and the Brig Wallace account routing and the fact that she hadn't mentioned it to Reyes. She was very glad she hadn't mentioned it to Reyes. She got up, dressed in the dark, and sat in the chair by the window, not visible from outside, angled so she could see the door, and waited for morning with her mind working through every person she'd met in the last 48 hours, mapping what they knew and when they'd known it and what they'd had the opportunity to pass on. By 4 a.m., she had a list of 2. By 5 a.m., she'd narrowed it to 1. And when the door to her room opened at 5:47 a.m., not knocked on, opened by someone who'd verified from the corridor that she was inside, she already knew who it was going to be. Tomas Reyes stood in the doorway with his laptop bag over his shoulder and his jacket on, and the particular look of a man who'd expected to find someone asleep. "You're up early," he said. She looked at him from the chair. "So are you." He looked at the bed, then back at her. Something shifted in his expression, the recalculation of a man who'd expected one thing and found another. "I was going to check on you before my morning briefing." "At 6 a.m., she said. He said nothing. "Someone called me last night on my burner," she said. "They had a number I bought with cash after I left the hospital. The only people who could have had it were people in that room with Lawson last night." She kept her voice level. "The offer they made expires at 6. Reyes's hand was still on the door. He wasn't moving. "The Brig Wallace routing account," she said. "It's in Pierce's documentation. I didn't tell you about it last night because I wanted to see if you'd find it. You didn't mention it." She tilted her head. "That's either because you missed it, which I don't think you did, or because you already knew it was there." "Hannah, don't." Her voice didn't rise. It just stopped him. "Don't explain it yet. I want you to understand that I've already photographed the relevant pages of Pierce's file with my phone before you took it, and I've already transmitted those photographs to a location that isn't connected to this network." A beat. "So whatever you were planning to do at 6 a.m., it's not going to work the way you thought." The silence in the room lasted approximately 5 seconds. Then Reyes took his hand off the door, turned around, and walked away down the corridor at a pace that was almost running, and Hannah picked up the burner phone. Not Reyes's contact, not Lawson's, but the direct line Pierce had given her that connected to the sergeant who'd looked at her in the trauma room like he recognized something, and she dialed it and waited. 2 rings. "Kowalski," the young sergeant answered. "I need Lawson's direct cell," she said. "Not through the federal relay, her personal phone." A pause. "Ma'am, I'm not supposed to." "Someone inside just tried to sell me out," she said. "I need her personal phone, and I need it in the next 30 seconds, or this whole case falls apart." Another pause, shorter. Then Kowalski gave her the number. Lawson picked up on the first ring. "Reyes is dirty," Hannah said. No preamble. He had my burner number, and he just walked out of this house with his bag packed. If you have any way to intercept him in the next 5 minutes, you need to do it now." There was a half-second of silence that wasn't disbelief. It was Lawson processing and moving simultaneously. Hannah could hear it. "Which direction did he go?" "East corridor. He had a car. Had to. Nobody walks out of a safe house at 6 a.m. without a car." "I have an agent 2 blocks out." The sound of keys, movement. "Stay in the room. Lock the door." The marshal outside my door might also be a problem. He let Reyes through without knocking. Another pause. Shorter. "Lock the door, Hannah. I'm 6 minutes out." She locked the door. Then she moved the chair under the handle, which wasn't protocol, but protocol hadn't kept Reyes out. She stood in the center of the room and listened to the building and counted her options, which were limited in a way she hadn't felt since a crumbling building in eastern Afghanistan with people dying faster than she could reach them. The difference was that here, the threat was wearing a suit. She heard the marshal outside shift his position. Footsteps. The particular sound of someone who'd been told to stand down or someone who'd been told something else entirely. She couldn't know which. She stood 3 feet from the door and waited, and the waiting was the hardest part, the way it always had been. Action she could handle. Stillness with an unknown approaching was its own specific discipline. Lawson arrived in 4 minutes, not 6. Hannah heard her in the corridor. The voice, the cadence of authority, the marshal responding with something defensive. Then a knock, 3 quick, and Lawson's voice directly through the door. "It's me. I'm alone." Hannah moved the chair. Lawson came in looking like someone who'd been driving fast and making phone calls at the same time, which was probably accurate. She took in the room, the chair that had been under the door handle, Hannah standing fully dressed with the burner in her hand, and nodded once, accepting the situation. "Reyes was picked up 2 blocks from here," she said. "He's in custody. He was on Mercer's payroll." "Appears so. We're working backwards through the case file now to identify what was compromised." She stopped. "How long have you known?" "I suspected when the burner number showed up in the offer call. I confirmed it when he came to my room and didn't know I was already awake." Hannah looked at her steadily. "The Brig Wallace account. It's in Pierce's documentation. I didn't bring it up last night because I was testing whether Reyes would. He didn't." Lawson stared at her. "You were running a test on a federal prosecutor." "I was running a test on everyone in that room," Hannah said. "You passed. He didn't." A long moment. Then Lawson pulled out her own phone and started typing something. "The Brig Wallace account. What's significant about it?" "The terminal account isn't a shell. It's a real financial institution with a real paper trail. If the transactions from that account can be subpoenaed before Mercer knows it's been identified, you have a direct financial connection between the Mirabad weapons sale and his personal network." She paused. "That's the kind of evidence that doesn't disappear. It's not testimony. It's math." Lawson stopped typing. She looked at Hannah with an expression that took a moment to identify. Not quite respect, not quite surprise. Something in between, edged with the particular awareness of someone realizing they'd underestimated a situation. "I need that photograph documentation," she said. "I know. Tell me where to send it." What followed was the kind of controlled chaos that resembled productivity from the outside and felt like barely contained disaster from the inside. Lawson worked the phone continuously. The Brig Wallace subpoena, a replacement prosecutor, emergency contact with a federal judge who apparently owed Lawson something or simply understood the time sensitivity because the authorization came back in under 2 hours, which Hannah understood was nearly impossible, and filed away as information about how hard Lawson had been working this case before any of them had met. Pierce was moved again. Hannah stayed with the operation because there was nowhere else to be, and because the alternative was sitting in a bland government room watching the walls, which was not something she was willing to do when the thing she'd spent 4 years running from was finally in arm's reach. At 11 a.m., Lawson came back into the room where Hannah had been going through the remaining documentation and sat down across from her with the look of someone delivering news they hadn't sorted out how to feel about yet. "Mercer knows the Brig Wallace account has been identified," she said. "We don't know how. Potentially Reyes got a message out before we picked him up. Or there's another leak we haven't found. He's moving. Moving how? He's pulled 2 assets from a private security contractor, Brig Wallace subsidiary as it happens, and we believe he's targeting witnesses. She paused. There's a civilian physician, Dr. Owen Salas. He treated Pierce in the immediate aftermath of the vehicle attack before the hospital. He was the first on scene, a civilian trauma surgeon who happened to be 2 cars back. He administered the field stabilization that kept Pierce alive long enough to reach Harwick. A beat. He's also on record as a potential corroborating witness because he documented what he found, the wound characteristics, the pre-existing field dressing that suggested prior military treatment, in his emergency report. Hannah went still. Where is he now? That's the problem. He's not at home and he's not answering his phone. Lawson's jaw was tight. We have reason to believe he was picked up within the last 90 minutes. The room became very clear in the way rooms became clear when the stakes stepped up another level and there was no longer any ambiguity about what was happening. They had taken a civilian, a doctor who'd stopped at an accident scene and done the right thing and written down what he saw, and now men working for a 2-star general had taken him somewhere because his documentation inconvenienced the story Mercer needed the world to believe. We have a probable location, Lawson said, a Brig Wallace property on the south end of the city, industrial, an old logistics facility. We have satellite imagery from 2 hours ago showing vehicle activity consistent with— Then go get him, Hannah said. I have a team staging, but there's a complication. Lawson met her eyes. Mercer is there. We believe he's there personally, which means this stops being a witness retrieval and becomes something significantly more complicated in terms of what we're authorized to do. What does that mean practically? It means I have jurisdiction to recover Dr. Salas and arrest Mercer if I can establish exigent circumstances. But if we go in wrong, if we move before we have the authorization fully locked, Mercer's lawyers will have him out and the evidence chain compromised before the ink is dry on the warrant. She spread her hands on the table. I need another 45 minutes to get the authorization aligned. Hannah looked at her. Dr. Salas doesn't have 45 minutes. I know that. Then we need to make a decision. Lawson was quiet for a moment. Hannah understood what she was carrying. A federal agent who'd built a case for months, who knew exactly what happened when you moved too fast and handed the defense an unlawful search argument that could gut everything. She understood the weight of it. She also understood that a civilian doctor was in a warehouse with men who'd already killed 2 federal agents and a convoy driver and arranged the deaths of 8 soldiers for profit. There's a way to establish exigent circumstances without going in, Hannah said quietly. Lawson looked at her. If Salas can be confirmed as a hostage in imminent danger, medical emergency, active threat to life, you have grounds for immediate entry without waiting for full authorization. Hannah kept her voice even. The question is whether we can confirm that from outside. We have no communication with anyone inside the facility. I know. A pause. But Mercer's people have been running a cell network in and out of that location. You said satellite imagery showed vehicle activity. Recent vehicle traffic means active communications. If someone with the right equipment could intercept the outgoing signal and confirm— Hannah, Lawson's voice had a particular weight. I know what you're suggesting. I'm suggesting that a former military signals and communications environment is something I have familiarity with, and that sometimes the information you need to justify the action is one transmission away. Silence. You're a civilian, Lawson said. I'm a nurse on administrative leave, Hannah said, which means I'm not bound by federal operational protocols. She met Lawson's eyes. I'm also the person who knows exactly what Mercer has to lose if that warehouse becomes a crime scene on the national news before his lawyers can manage the narrative. Lawson looked at the table, then at the window, then at Hannah, with the expression of a woman who'd been a federal agent long enough to understand that some decisions existed in a space that wasn't fully covered by the manual. I can't authorize you to do anything, she said carefully. I know. I can tell you that the facility's eastern perimeter is outside the established security cordon. There's no active federal presence in that quadrant. She paused. I can also tell you that we identified a communications relay on the facility's eastern wall from the satellite imagery, consistent with the kind of setup used for encrypted short-range cell traffic. Hannah stood up. 45 minutes, Lawson said. That's when my authorization comes through regardless. At that point, we're going in. I know, Hannah said. She was already moving. The eastern perimeter of the Brigg-Wallace facility was a chain-link fence behind a row of half-dead oleanders, and Hannah reached it 11 minutes after leaving the staging area on foot, moving in the drainage easement that ran parallel to the access road. The sun was fully up now. Wrong time of day for this kind of approach. Too much light, too much open ground, but the eastern face of the building had no windows, and the security presence was concentrated on the vehicle entrances to the west. The communications relay was where Lawson's imagery had placed it, a mounted unit on a utility bracket, 8 feet up the eastern wall. She didn't need to touch it. She needed to be within range of its signal, which she was, and she needed the device in her pocket, which Kowalski had produced from somewhere without asking questions because Kowalski was shaping up to be exactly the kind of person she needed right now. The signal intercept took 4 minutes. Most of what came through was encrypted and unreadable, but 2 transmissions were in clear voice, internal coordination, the kind of short-range communication that didn't bother encrypting because it wasn't supposed to leave the building. The first was logistical, irrelevant. The second lasted 9 seconds, and what she heard in those 9 seconds made her close her eyes for exactly 1 moment before she opened them and started moving. A man's voice, clipped, commanding, saying, "The doctor is conscious. Mercer wants him moved before the authorization window closes." 30 minutes. They were moving Solace, which meant in 30 minutes he would be somewhere Lawson's warrant didn't cover, with men who had no reason to keep him alive once he was clear of the facility. She had her phone out and was calling Lawson before she'd cleared the oleanders. "They're moving Solace in 30 minutes, she said. "That's your exigent circumstance. Imminent transfer, active hostage, documented transmission." She was already walking fast toward the staging area. "Mercer is inside. You have everything you need." A pause that lasted 2 full seconds. "How do you know about the transmission?" Lawson said. "Does it matter right now?" Another pause. "No," Lawson said. "Get clear of the perimeter. We're moving in 8 minutes." Hannah moved clear of the perimeter. She found a position behind a utility shed 60 meters from the eastern fence and watched the facility and waited. And the waiting was bad, but different from before. Not the waiting of helplessness, but the waiting of someone who'd already done the thing that needed doing and now had to let other people do theirs. 7 minutes passed. Then she heard the helicopters. 3 of them, coming from the north. Not law enforcement rotors, military, which meant Lawson had called in something beyond the FBI's standard response, which meant the case had escalated to a level above what Hannah had understood from the inside of a government safe-house bedroom. The vehicles hit the western entrance simultaneously. She could hear it from 60 meters away. Controlled breach, the specific sound pattern of a forced entry done by people who'd trained for exactly this. And she stayed where she was because she wasn't armed and wasn't authorized and had approximately 0 tactical role in what was happening on the other side of that building. The facility went loud for approximately 4 minutes. She tracked it by sound. Not a firefight, not exactly. More like the sound of resistance meeting overwhelming force and making the rapid decision that surviving was preferable to proving a point. Then quiet. Then radio traffic she couldn't hear clearly but could see reflected in the movement of agents around the perimeter, converging, securing. She was still watching when her phone buzzed. Lawson. "We have Solace. He's injured. They'd worked him over, but he's conscious and stable. We're getting medical to him now." A breath. "Mercer is in custody. So are 4 contractors." Hannah leaned against the utility shed and looked at the sky for a moment. Clear and pale blue and enormous in the way the Tucson sky always was, like it was showing off. "Hannah." Lawson's voice had changed, something careful in it. "Mercer asked for you." She straightened up. "What?" When they cuffed him, he asked specifically if Hannah Brooks was part of this operation. When they told him you were a civilian witness, he... A pause. "He laughed. He said something I need to tell you in person. Can you come to the west entrance? She was moving before Lawson finished the sentence. The west entrance was controlled chaos. Vehicles, agents, contractors, and zip ties being processed against the side of a black SUV. Salas was being loaded into an ambulance, conscious, one eye swollen shut, arm held at an angle that suggested at minimum a fracture. She looked at him long enough to confirm he was breathing and coherent, and then a federal agent was walking her toward the far side of the staging area where Lawson was standing with two men Hannah didn't recognize. One of them was Mercer. He was in his 60s, silver-haired, with the bearing of a man who'd spent 40 years being saluted. The zip ties looked wrong on him, like a costume piece on someone who hadn't agreed to wear it. He looked at Hannah when she came into his eye line, and his expression was not what she'd expected. He wasn't afraid. He was studying her. "You're smaller than I thought," he said. She said nothing. "I've known about you since 2020, he said, since someone flagged that a medic from Mirabad hadn't fully disappeared. We watched you for 18 months. Then we decided you weren't a threat." He paused, and something moved in his expression. Not regret, not quite respect, something more clinical than either. "We were wrong." "Appear so," she said. "It won't matter." His voice was completely steady. "You understand that, yes? The financial documentation, the Brig Wallace records, those will be challenged on provenance grounds. Pierce's testimony has credibility issues given his history of insubordination. Your testimony will be attacked as motivated. General Mercer," Lawson's voice cut across cleanly, "you have the right to remain silent. I'd suggest you use it." He looked at Lawson, then back at Hannah. And then he said the thing that Lawson had called her across the staging area to hear, said it quietly enough that only the three of them caught it. "There are 7 other operations," he said. 7. Mirabad was the smallest, and the people above me in those operations, people whose names aren't in any document Pierce could have accessed, are going to make sure this never reaches a courtroom. A smile that didn't reach his eyes. "I'm not worried, Ms. Brooks. You should be." An agent stepped forward and began moving him toward a waiting vehicle. Hannah stood in the parking lot of a logistics warehouse in Tucson, watching a 2-star general be loaded into a federal vehicle with zip ties on his wrists, and felt something that was not triumph, was nowhere close to triumph, because the words 7 other operations were still in the air. She turned to find Lawson watching her. 7, Hannah said. "I heard him." Lawson's face was unreadable. "It might be a bluff." "You don't think it's a bluff?" A pause. "No," Lawson said. "I don't." The ambulance carrying Salas pulled out onto the access road. The helicopters were still overhead. And somewhere in the federal vehicle moving toward the processing facility, a man who'd had 8 soldiers killed for profit was telling them that what they'd found was the small end of something very large. Hannah looked at Lawson. "Then we're not done," she said. Lawson met her eyes. "No," she said. And then her phone rang. Not her cell, the secure radio on her belt. And when she looked at the screen, something changed in her face. Something that made Hannah's stomach drop before Lawson said a single word. "It's from the secure facility," Lawson said. Her voice had gone flat. "It's Pierce's nurse. She says—" She stopped, pressed the radio to her ear, listened for 4 seconds. Then she looked at Hannah with an expression that was the controlled face of someone delivering information they hadn't prepared for. "Pierce has been moved," she said, "not by our people." The nurse's name was Petra Voss, and she'd been on shift for 6 hours when 2 men arrived at the secure facility with credentials that cleared every checkpoint. She'd watched them wheel Pierce out in a transport chair, IV still running, neck brace in place, and she'd thought it was authorized because the paperwork said it was authorized and the credentials were real. She told Lawson this twice, her voice shaking through the radio, the way someone sounds when they understand they've been used and can't undo it. "How long ago?" Lawson said. 14 minutes. Maybe 15. Lawson was already moving toward her vehicle. Hannah fell into step beside her without asking, and Lawson didn't tell her to stop, which was its own kind of answer. "They used real credentials," Hannah said. "Mercer's network runs deep into administrative structures. Generating plausible federal transport documentation isn't difficult if you have the right access. Lawson got in the car, and Hannah got in the passenger side, and Lawson was on the phone before the engine turned over. The question is where they're taking him and why they're taking him now. Mercer is in custody. His primary contractors are in custody, so whoever moved Pierce is operating on a contingency plan that was already in motion. Mercer said there were people above him. I know what he said. Then Pierce is leverage. They're not going to hurt him yet. He's more valuable as a bargaining chip than as a casualty, at least until they know how much we have. Lawson glanced at her. You're thinking tactically. I'm thinking like someone who's been a target of this network and would like to not still be a target in 48 hours. She looked at the road. Where would you move a compromised witness if you needed him contained but not permanently? Somewhere with deniability. Somewhere that isn't flagged in any federal database. Lawson paused. Somewhere with medical capacity, because Pierce is post-surgical, and if he dies in transit, that's a different set of problems. Brig Wallace has more than one facility. We're pulling their property records now. Lawson's phone was ringing again on the console. She put it on speaker. A man's voice, one of her analysts, running fast and clipped. We found 2 additional Brig Wallace adjacent properties in the metro area. One is a warehouse that's been commercially leased since 2021. The other is a private medical annex registered under a subsidiary name, Vantage Care Solutions, in the South Mountain District. Full medical suite, registered as an outpatient surgical center, hasn't had any inspection since 2022. That's the one, Hannah said. Lawson was already entering the address. Haute. The South Mountain facility was 40 minutes out in normal traffic. Lawson made it in 26, which involved speeds and lane changes that Hannah tracked without comment. The radio traffic in the car told the story of a federal operation expanding in real time. More warrants, more authorization, more personnel being redirected. All of it converging on a private medical building in a commercial district that looked, from the outside, like exactly what it claimed to be. They staged 2 blocks out. Lawson's team was 8 agents plus 2 military liaisons Kowalski had coordinated from his end, and the briefing happened in a parking lot in 4 minutes. Short enough to be useful, not so long that whatever was happening inside had time to get worse. Hannah stood at the edge of the group and listened. She wasn't part of the operational briefing. She understood that. But she was also the only person in the parking lot who'd treated Pierce's actual wound, who knew his current medication schedule, who understood exactly how fragile a man recovering from a vascular trauma to the neck was if someone decided to put him under any kind of stress. When Lawson finished the briefing, she turned to Hannah. You stay here, she said. If Pierce needs medical intervention, I have a paramedic on the team. Your paramedic hasn't seen the wound. Hannah kept her voice even. I have. I know what's been sutured, what's vulnerable, what will kill him if it goes wrong. If they've tampered with his IV or his monitoring, or if the transport compromised anything, your paramedic is going to be working from scratch, and Pierce is going to be the one paying for it. Lawson held her gaze for a long moment. Then she said, You stay behind the entry team. You go in only when I call you in. If it becomes a tactical situation, you get down and you stay down. Understood. I mean it, Hannah. So do I. It wasn't a clean entry. None of them were, regardless of how they looked in retrospect. The front of the facility was clear, but the interior had a secondary lock system that took 90 seconds to defeat, and 90 seconds was enough time for someone inside to know they were coming. By the time the entry team cleared the front corridor, 2 of Mercer's remaining contractors had positioned themselves at the interior junction. Not shooting, not yet, hands visible but bodies wrong. The specific stance of men deciding in real time how badly they wanted to test the situation against 8 federal agents. They didn't test it. One of them sat down on the floor and put his hands on his head, and the other followed after a moment that lasted long enough to be uncomfortable. Lawson's team moved through them and kept going. Pierce was in the back. Hannah heard Lawson call her name from the corridor and moved up through the building, past agents processing the 2 contractors, past a room with monitoring equipment that had been active recently, screens still warm, data still cycling, into a room at the rear that had been set up with the minimal functionality of someone who expected to need it temporarily. Pierce was in a chair, not the bed. A chair which told her something about the state of his compliance, because Pierce, in a chair with a neck wound and post-surgical drainage, was Pierce who had argued with whoever put him there. His IV was intact. His neck brace was on. His color was wrong, the gray-white of someone whose blood pressure had dropped and wasn't entirely recovering. He looked at her when she came in with the particular expression of a man who'd been through enough that relief and embarrassment had fused into something he didn't have a word for. "Your blood pressure's low," she said, crossing to him. "I noticed," he said. "Did they touch the IV?" "No, they were careful, in a clinical way." He paused while she checked his pulse at the wrist, noting the rate and quality. "There was a man here, before your people arrived. He wasn't one of the contractors." She kept her attention on his pulse. "Describe him." 60, maybe 65, civilian, expensive suit, which tells you something in this context. He introduced himself as Raymond Holt. He stopped. Not the Dr. Holt from Harwick. A different name, different register. He told me the situation had changed, that Mercer's arrest was, he used the phrase, a containable event. He said the network was larger than what the federal case had identified, and that this was a demonstration of that fact. Pierce's voice was steady, but she could feel the pulse underneath it. Irregular, too fast. He said the offer was still open, the same offer they made you. Hannah looked up from his wrist. He mentioned me specifically. By name. Pierce met her eyes. He knows you transmitted the Brigg-Wallace documentation. He said, and this is the part I want you to hear clearly, he said the account records will be there when investigators look for them, that they've already been modified. She stayed very still. He said the modifications were made this morning, before the warrant executed, that what investigators will find now is a version of those records that points away from Mercer's network and toward. Pierce stopped. His expression was the specific grimness of someone delivering a thing they'd rather not. Toward you. A series of transactions connected to a financial account in your name that was open in 2021. The room was very quiet. He's framing you, she said. The words were flat, factual, the way she processed bad information when she didn't have time to react to it. It's what he said. She stood up straight and looked at the wall for a moment. Then she turned and found Lawson in the doorway. Lawson had been there long enough to have heard most of it, judging by her expression. The Brigg-Wallace records have been tampered with, Hannah said. I heard him. Lawson's voice was careful in the way of someone managing a serious anger. We'll pull the original subpoena capture. There should be a timestamp. If they got to the records, they got to the timestamp. Not necessarily. There's an independent federal archive that captures Lawson. Hannah stopped her. How many more Reyes are there? How many people in this pipeline are connected to whatever Raymond Holt represents? The silence that followed was answer enough. Hannah looked back at Pierce. He was watching her with the steadiness of a man who'd seen enough things go wrong that he'd stopped being surprised by it, which was not the same as being okay with it. He reached into the pocket of the hospital gown, which should not have had a pocket, but apparently did, because Pierce was the kind of man who'd argued for that too, and produced a folded piece of paper. He left this, Pierce said. I don't know if it's real or another layer of the frame, but I memorized it before he left because I didn't know what else to do. She took it, unfolded it. It was a routing number and an account number, handwritten, with a date beside it, 3 days ago. And below that, a single line, first transaction. More to follow until you cooperate. She handed it to Lawson without a word. Awesome. The next 4 hours were the kind of work that didn't look like anything from the outside. Rooms with laptops, phone calls that lasted 3 minutes and changed everything. Legal arguments conducted between people who communicated in sentence fragments because they all knew what the other half of the sentence was. Hannah sat in the Vantage Care facility while it was processed as a crime scene, and she answered questions when asked, and she thought very carefully about what she knew. The frame was real. She understood that. Raymond Holt, whoever he was, whatever he represented above Mercer in the network, had prepared it in advance, which meant he'd known from the beginning that the Mercer layer might be penetrated. This was the contingency. Let Mercer take the fall, redirect the evidence, Make the person who'd built the case look like the criminal. It was elegant in the same way the original Brigg-Wallace architecture had been elegant. It assumed investigators would trust the paper and distrust the person. What it didn't account for, what Hannah understood, sitting in a repurposed medical room in South Mountain while Lawson's team worked, was the thing she'd photographed on the burner phone before Reyes had taken Pierce's original documentation. The photographs existed on a device that had not been connected to the federal network, that had been transmitted to a number Kowalski had given her, and that was therefore outside the chain of custody that Holt's people had compromised. But photographs of documents weren't the same as the documents. A defense attorney would argue manipulation, alteration, any number of things. What she needed was something that predated Holt's modification, a fixed point in the record that couldn't have been touched. She thought about the Brigg-Wallace account, the real one, the terminal account at the real financial institution. She thought about the fact that financial institutions kept their own records. She thought about the fact that a federal subpoena of a bank's internal records, not the modified version Holt's people had altered, but the bank's own internal ledger, which existed on servers that had nothing to do with the federal evidence chain, would show exactly the same transactions the original documentation had shown. She got up and found Lawson. The bank itself, she said, not the records that were subpoenaed, the bank's internal ledger. Holt's people modified the records in the federal evidence system. They couldn't have touched what's on the bank's own servers. If you subpoena the originating institution directly, Lawson stared at her. They'd have to show the original transactions, Hannah said, before any modification. The bank records would contradict the modified federal evidence, which proves the modification happened, which is its own crime. She paused. And modified federal evidence is obstruction, which gives you Holt. Lawson turned to her analyst. Which bank? The routing number on the note Pierce gave us. It's a regional institution. First Meridian, they have a branch in Phoenix. Get me a judge. Now. Lawson was already moving. Then she stopped and looked back at Hannah. How did you know to focus on the routing number? Pierce gave us that note 20 minutes ago. Hannah met her eyes. Because Holt wanted us to find the account in my name. He left the routing number on purpose. He thought it would reinforce the frame. He didn't think about what else a routing number tells you. Lawson looked at her for a moment that had a particular quality. Not wonder, not surprise, just a clean and undefended acknowledgement of something real. Come with me, she said. The First Meridian subpoena executed at 4:47 p.m. The bank's legal team complied within the hour, as financial institutions tended to do when federal investigators showed up with paperwork and urgency and the specific language that made delay inadvisable. The internal ledger pulled from their servers showed 18 months of transactions through the account in the Brigg-Wallace routing sequence, and not one of them pointed anywhere near Hannah Brooks. What they pointed to, consistently, with the straightforward clarity of numbers that didn't know how to lie, was a series of disbursements to personal accounts connected to three names. Leonard Briggs, who'd been Mercer's primary civilian contractor and who was already in custody. A former Pentagon procurement officer named Dale Schaffer, who was as of that afternoon unreachable by any of his known contacts. And Raymond Holt, whose full name was Raymond Holt Grierson, and whose connection to the defense procurement structure was not as invisible as he'd apparently believed. Lawson had the warrant for Grierson inside 40 minutes of the bank records coming through. She had agents at his last known address in Scottsdale in 50. And she had him in custody at 7:22 p.m., which was when Hannah's phone buzzed with a text from Kowalski that said simply, "Got him." She was at the federal processing facility on the east side of the city when they brought Grierson in. And she wasn't supposed to be there. She was a civilian witness. She had no operational role. But Lawson had stopped pointing that out several hours ago, and the agents who knew what the last 12 hours had looked like didn't question her presence in the corridor. She saw him through the glass. Grierson was everything his voice on the phone had suggested. 63, she'd learn later, with the composed and well-maintained appearance of a man who'd spent his career in rooms where composure was currency. He sat at the processing table without the visible anxiety of someone newly arrested. He sat like a man waiting for a meeting that had run slightly over schedule. He's going to lawyer up immediately, Hannah said to Lawson, who was standing beside her. Of course. Will it matter? Lawson looked through the glass at Grierson. The bank records are clean. The modification to the federal evidence chain is documented. We have the timestamp discrepancy and a digital forensics team confirming the alteration. We have Pierce's testimony about his direct conversation with Grierson. We have the Vantage Care Facility, the contractors who've already started talking, and Mercer, who is... She paused. Mercer is talking too. Hannah looked at her. Since when? Since about 2 hours ago, when his lawyer explained to him that Grierson's contingency plan had involved throwing Mercer's name to us on a platter, setting up the Brig Wallace exposure to land on Mercer specifically, using Mercer as the documented face of the operation while Grierson's layer stayed clean. Lawson's voice was measured. Mercer didn't know he was designed to be expendable. He's processing that. Hannah thought about the man in zip ties who'd smiled and told her he wasn't worried. She thought about the 7 other operations. Is he giving up Grierson's full network? He's giving up everything, Lawson said. The operations above Mirabad, the financial channels, the names, all of it. She paused. He's not doing it out of conscience. He's doing it because he's 61 years old and he just found out his own people built a trapdoor under him. But the information is the same regardless of the reason. Hannah looked at Grierson through the glass. The man who'd called her in the middle of the night with a settlement offer. The man who'd arranged to put her name on transactions she'd never made, to construct a paper version of her as a criminal that federal investigators would find when they went looking. The man above the man she'd spent 4 years as the casualty of, representing a layer of the operation she hadn't known existed until this morning. She'd been a minor inconvenience to him. That was the most clarifying thing. That she had been so far below his operational concern that the frame he'd built for her had been assembled in a morning, as an afterthought, because she'd become briefly inconvenient to a system that had been running for years before Mirabad, and had expected to run for years after. He looked up through the glass. She didn't know if he could see her. The lighting might have made it one way, but he looked in her direction, and his expression didn't change, and she thought, "You assumed I'd take the offer." She thought, "That was your actual mistake." The formal witness statement Hannah gave the following morning was the 5th interview she'd given in 3 days, and it was the first one that felt like it was going somewhere real. Lawson sat across from her with a prosecutor named Adeyes Moro, brought in from the U.S. Attorney's Office in Phoenix, no connection to the compromised case chain, who was brisk and thorough and asked questions in a sequence that told Hannah she'd already read everything and was looking for confirmation, not information. They went through Mirabad in detail, not the military operational aspects, but the documentation, what Hannah had filed, the specific language of the 3 written communications she'd submitted before the mission, what she'd been told and by whom and through which channels. The original files were destroyed, Hannah said, or removed from the record. I submitted them through the standard medical brief documentation chain. Are you certain they were removed as opposed to misfiled or lost? The person who told me they didn't exist was the same person who'd signed one of them as received. She kept her voice even. He signed as received and then told investigators the document had never been submitted. Morrow wrote something. And your discharge documentation, the administrative separation, was based on findings from an investigation that used the absence of my documentation as evidence of my failure to prepare adequately for the mission. Hannah looked at her steadily. If the documentation exists, or if the communication log showing it was received exists somewhere in the system, the discharge should be reversible. We're working with the military records branch, Morrow said. Commander Pierce's testimony includes specific reference to the record modification. The communication logs are, she glanced at her notes, more intact than Mercer's people believed. They deleted the document files. They didn't delete the routing metadata that shows the files existed and were transmitted. Hannah heard this and did not allow herself to feel anything about it yet. Feeling something about it could happen later, when the situation was no longer active. Metadata from a file that no longer exists is admissible? In conjunction with Pierce's direct testimony and the chain of custody documentation for the investigation file? Yes. Morrow closed her notebook. I want to be honest with you about timeline. This is going to take months. The military record correction process is Slow. The criminal prosecution will move faster, but it has its own pace. I don't want you to expect resolution by the end of the week. I've been waiting 4 years, Hannah said. I can manage months. Morrow looked at her for a moment with an expression that wasn't quite professional neutrality. For what it's worth, she said, and then seemed to decide how to finish it. The documentation you transmitted from Pierce's file, the photographs taken before the modification, is what gave us the clean comparison point. Without that, the bank records alone might not have been sufficient to establish the modification definitively. She paused. You thought about that in a safe house bedroom at 2 a.m. I've had practice thinking clearly when things are going badly, Hannah said. She wasn't being modest. It was simply accurate. Tab. Pierce was moved to a legitimate medical facility that afternoon, Harwick Regional, which was either irony or efficiency, and Hannah suspected both. She went to see him that evening, which required navigating a security checkpoint she hadn't had to navigate before, and found him in a private room on the 4th floor looking considerably better than he had in the South Mountain chair, which wasn't a high bar but represented real progress. He was watching the news when she came in. The sound was low, but she could see enough. Press conference footage, federal spokespeople, the particular choreography of an investigation going public in controlled increments. Mercer's name was already in the chyron, Briggs's name, the Vantage Care Facility. Not Grierson's yet. That would come. They moved you back here, she said. Someone thought there was a certain logic to it. He looked at her. His color was better, the neck brace was the same, the IV was running correctly. Sit down, Hannah. She sat. I know I don't get to tell you how to feel about any of this, he said. I know that. I'm not going to try. He looked at the television for a moment, then back at her. I want to tell you something that I've been figuring out how to say since I was lying on a gurney in that trauma room, and you were the one keeping me alive. She waited. In 2019, when I got the communication from Mercer telling me to pull your files, I told myself I didn't have a choice. That's the story I used. He stopped. That's not true. I had a choice. I made it. And I've been trying to correct it ever since, but trying to correct something doesn't undo the choosing. I know that. The room was quiet. Outside the window, Tucson was going into evening, the particular amber light of desert dusk that she'd grown to recognize over 8 months in this city. The thing I keep thinking, Hannah said, and she was surprised to find she meant it, is that you spent 4 years building that file. You could have left it, you could have decided the risk wasn't worth it, and the case wasn't your problem anymore. She looked at him. I'm not forgiving you. I'm not in a position to do that yet, but I can hold both things at once. He nodded. Once. The nod of someone who understood that this was all they were going to get, and that it was, by some measure, more than they deserved. The 7 operations, she said. Mercer's giving them up. Lawson told me. I want to know if any of them look like Mirabad. If there are other people. There are, he said. I've seen some of what he's describing. Other cases, other soldiers who came home to wrong outcomes, other documentation that disappeared. He met her eyes. Lawson's building a task force. Morrow's office is coordinating with 3 other U.S. attorney districts. It's bigger than this, Hannah. What we started here is bigger than Mercer and Grierson. She'd known this. She'd known it from the moment Mercer had said 7 in a parking lot with zip ties on his wrists and no anxiety in his voice. But hearing Pierce say it, hearing it from someone who'd seen the inside of it, made it real in a different way. They're going to want you to stay involved, Pierce said. Lawson will ask you, formally. I know. Are you going to? She looked at the television. The press conference had moved to a different angle, a shot of the Brig Wallace Logistics Facility, yellow tape, agents and windbreakers. Somewhere in an editing room, someone was already building the version of this story that the public would receive. I need to sleep first, she said. I haven't slept properly in 3 days. Pierce almost smiled. That's not a no. No, she said. It's not. She left him there with the news on low and the IV running and the security checkpoint outside his door that was this time genuinely federal. She took the elevator down and walked through the emergency entrance of Harwick Regional, past the trauma bays, past the nurse's station where Deborah Osei was standing with a chart in her hand. Deborah looked up when she came through. They looked at each other across the ER floor. The charge nurse who'd told her to stay out of everyone's way on her first day, and the nurse who'd been placed on administrative leave 4 days ago and had spent the intervening time dismantling a defense contractor conspiracy. Deborah opened her mouth. "I know," Hannah said, and kept walking. She was almost to the exit when her phone buzzed. Not Lawson, not Kowalski. A number she didn't recognize, and in the last 4 days she'd learned to be careful about those. She stopped near the automatic doors and answered. A woman's voice, older, measured, with the specific diction of someone accustomed to being listened to. "Ms. Brooks, my name is Adela Voss. I'm the Inspector General for the Department of Defense." A pause. "I understand you've had quite a few days." Hannah stood still. "I've been briefed on the situation through the U.S. Attorney's Office," Voss continued. "I want you to know that our office has been independently aware of concerns regarding the Mirabad operational record for approximately 16 months. We've been building our own investigation, separate from what Lawson's task force was developing, for reasons that will become clear." She paused. "I'd like to meet with you, tomorrow, if that's possible." "Why?" Hannah said. "Because there's something about the Mirabad record that hasn't surfaced in any of the documentation you've worked with," Voss said. "Something we found that changes the scope of what you know." A beat. "And because I need to tell you in person before it becomes part of the public record." The automatic doors opened beside her, letting in the warm evening air. She stood in the threshold between inside and outside, thinking about a woman she didn't know asking her to hear something she hadn't prepared for. "What kind of something?" she said. "The kind that means your warnings before the Mirabad mission were not just filed and removed," Voss said. "They were reviewed at a level above Mercer, and a decision was made, documented with signatures, that the mission would proceed regardless, specifically because the resistance you documented was considered acceptable collateral risk." A pause. "There are 4 names on that document, Ms. Brooks. None of them are Mercer. None of them are Grierson." Hannah stood in the doorway of Harwick Regional Medical Center, and the evening air moved around her, and she heard what the Inspector General was telling her with the clear, cold understanding that the thing she'd thought they'd just finished was not, in fact, finished. "Send me a location," Hannah said. "I'll have my office contact you in the morning." The call ended. Hannah walked to her car and sat in it in the parking garage and looked at the dirty concrete wall in front of her for a long moment. 4 names above Mercer and Grierson. 4 signatures on a document authorizing the deliberate sacrifice of 8 soldiers, with the person who'd tried to prevent it identified as acceptable collateral damage in the same breath. She'd spent 4 years thinking this was about one general with an operation to protect. It was much larger than one general. Her phone buzzed again. This time it was a text from Lawson. "Grierson is talking. You need to hear what he's saying. Can you come back in tonight?" She started the car, then stopped, because there was something in her peripheral vision, not behind her, not a tail she'd been checking, but in the rear-view mirror looking out through the rear windshield at the parking garage entrance. A black vehicle had pulled across the entrance at an angle that wasn't parking, blocking. The 2 men who stepped out of it were moving with the purposeful unhurry of people who'd been waiting for her to be alone. She recognized one of them. Not from Tucson. From a photograph. From the top right corner of a communication routing log in a file she'd memorized 3 days ago. He was one of the 4 names. Her hand went to the gear shift and she was already thinking about the ramp, the exit, the service road, whether there was another way out of this garage that she hadn't used before. And she was doing all of this in the calm, cold, utterly functional state she'd learned in a building in eastern Afghanistan, while people were dying faster than she could reach them. But the man in the photograph was on the phone, not moving toward her, and his expression wasn't tactical. It was something else, something she couldn't read from this distance. And the black vehicle wasn't blocking the exit completely, just the main entrance. He looked directly at her car, and he held up both hands up. The gesture was universal, and she didn't trust it, but she also didn't move, because a man who wanted to hurt her wouldn't be standing 20 feet from her car with his palms visible and his phone put away. He'd be closer. He'd be moving differently. She'd spent 6 years learning the difference between someone approaching with intent and someone approaching with a message, and this read as the latter, which didn't mean she was comfortable, just that she wasn't reversing out of the garage at speed yet. She cracked the window, 2 inches. "My name is Warren Falk," he said. His voice carried the distance between them without effort, the practiced projection of someone who'd spent time in rooms where you needed to be heard. "I was Deputy Assistant Secretary of Defense for Acquisition from 2017 to 2021. My name is on the Mirabad authorization document that Inspector General Voss told you about 20 minutes ago." He stopped. "I know she told you because I've been in contact with her office for the last 6 weeks. I'm the one who gave her the document." The garage was quiet except for distant traffic and the low hum of the ventilation system. "You're one of the 4 names," Hannah said through the window. "Yes." "And you gave the IG the document that proves it?" "Yes." She looked at him. He was in his late 50s, the kind of man who looked like he'd carried something heavy for a long time and had finally put it down but still moved like it was there. His suit was expensive and his face was not. "You want me to get out of this car," she said. "I want to explain something to you before you hear it through official channels where it'll be flatter and more complicated than it actually is." He kept his hands visible. "I won't take long." She thought about it for approximately 5 seconds. Then she got out of the car and stood in the gap between the door and the frame, which gave her the door as an option if she needed it. "Talk," she said. "The 4 signatures on that document, 2 of them are people who are going to be indicted as part of the Mercer-Grierson prosecution. One of them died last year, cardiac event, which is not as convenient as it sounds because he'd already cooperated with Voss's office before he died." He paused. "And then there's me." He looked at her directly. "I signed the authorization in 2019 because I was told the intelligence was solid and the mission parameters were sound. I wasn't told about your warnings. I wasn't told about the field reports you'd flagged. I was shown a version of the intelligence package that had already been curated by Mercer's people." Hannah said nothing. "I found out the truth in 2022. A former analyst came to me with documentation of what had been removed from the package before it reached my level. I spent 3 months verifying it, and then I went to the IG's office." He stopped. "I'm not telling you this to ask you for anything. I'm telling you because you're going to sit across from Voss tomorrow, and she's going to present a document with 4 names on it, and 3 of those names represent men who made decisions that killed 8 soldiers for money. I didn't make that decision. I want you to know that before it becomes a legal document and loses its context." The garage air was warm and still. Somewhere above them, Tucson was moving through its evening with no knowledge of any of this. "Did you know about the file removal?" she said. "My documentation." "Not until 2022. "And when you found out?" "I went to the IG. His voice was steady. "I know that doesn't undo anything. I know that's not absolution. I'm not—" He stopped. He looked like someone running out of the words he'd prepared, which she'd learned was often when people said the most accurate things. "I'm sorry." "That's not sufficient, but it's true." She held his gaze for a long moment. "Give Voss everything you have," she said finally. "Every piece of documentation, every communication, every conversation you remember. Make it irrefutable." She paused. "That's what you can do." He nodded. "I already have." She got back in the car. She drove out of the garage and into the Tucson evening, and she went to see Lawson, and she didn't look in the mirror once. Grierson's testimony lasted 9 hours across 2 sessions. Hannah wasn't in the room for any of it. She had no role in the interrogation, and she wouldn't have wanted one. What Lawson told her afterward, in the utilitarian corridor of the federal building at 11 p.m. while they both drank coffee that had been sitting too long, was enough. Grierson had given up the network because the network had given him up first. The modifications to the federal evidence system had been traceable, and the moment Morrow's office established that they were traceable, Grierson's calculated composure had developed cracks. Not large ones. He was the kind of man who didn't break dramatically. He recalibrated. He made the decision that controlled disclosure gave him more leverage than stonewalling, and he began to talk with the methodical precision of someone who'd been in rooms where information was currency for 40 years and knew exactly how to spend it. 7 operations, Lawson said. 4 of them are ongoing. 2 have been dormant since 2021. One is the Mirabad template. The same structure, different region, more recent. She looked at her coffee cup. There are names in there that are going to be very public very soon. People at levels of the defense acquisition structure that are going to require the kind of political management that goes above my pay grade. Is it going to hold? Hannah asked. The case? All of it. The prosecutions, the military record corrections. Is it going to hold when lawyers start working on it and political pressure starts building and it stops being a news story and starts being a long process that people can erode over time? Lawson was quiet for a moment. Some of it will. Some of it will take longer than it should. Some of the people on Grierson's list will find exits through legal complexity that make me want to quit this job. She looked at Hannah. But the Brigg-Wallace financial chain is clean and documented, and the bank records are in federal custody and can't be modified. The Mirabad operation specifically, the evidence there is the most airtight I've built in 20 years. That one holds. Hannah nodded. Your record correction is going to move faster than the prosecutions, Lawson said. Voss's office is coordinating with the military branch directly. Pierce's testimony, the routing metadata, the communication logs. It's enough. The military board can act on that without waiting for the criminal process. She paused. A days Morrow told me to tell you to expect formal contact within 60 days. 60 days. After 4 years. Hannah drank her stale coffee and thought about 60 days. The formal notification came in 53. It was a letter, physical paper, official letterhead, and she opened it standing at her kitchen counter in the apartment she'd gone back to after the safe house, which had been cleared and was now monitored in a way that made her slightly less comfortable, but significantly more secure. She read it twice. Then she put it down on the counter and stood there for a while. Her military record had been corrected. The administrative discharge was overturned, replaced with an honorable separation. Her rank, staff sergeant, was restored. Her decorations, which had been stripped from the record in the investigation's aftermath, were reinstated. And at the bottom of the letter, in the particular formal language of military institutional acknowledgement, a finding that her pre-mission documentation had been improperly removed from the record, that her warnings had been both timely and accurate, and that her conduct throughout the Mirabad operational period had been consistent with the highest standards of her training and role. Your conduct was consistent with the highest standards. She'd known this. She'd known it from the moment she'd stood in that crumbling building in eastern Afghanistan and done her job while the mission collapsed around her through no failure of hers. She'd carried that knowledge through 4 years of people treating her like she was slow and forgettable and not worth the space she occupied. Having it said by the institution that had taken it from her was not the same as knowing it. It was something different, something she didn't have a clean word for. Not vindication exactly, because vindication implied she'd needed external confirmation to believe the truth about herself, and she hadn't. But something. Closure was the word people used for this, and it was the wrong word. This wasn't closed. The 8 soldiers were still dead. 3 more were still carrying their injuries. Nothing that happened in courtrooms and military review boards brought any of that back. What it was, she thought, was accurate. The record was finally accurate. The version of events that existed on paper now matched the version that had existed in reality all along, and that mattered. Not because paper was more real than her own memory, but because paper was what other people used to understand the world. And for 4 years, the paper version of Hannah Brooks had been a lie. She folded the letter and put it in the drawer where she kept things that were important. Then she called Lawson and said, "I got the letter." "I know," Lawson said. "Morrow called me." A pause. "How are you?" "I'm working on figuring that out," Hannah said, which was the most honest answer she had. The trial began 11 months later, and it was not the clean televised event that news coverage sometimes made federal prosecutions appear. It was slow and technical and required a level of attention to financial documentation that cleared the courtroom of casual observers within the first week. Hannah testified on the 4th day of the prosecution's case. She'd been told to expect aggressive cross-examination. She'd been told that Mercer's defense team was competent and well-funded and would attempt to use her military record, specifically the period before the correction, which they would argue demonstrated a prior pattern of instability and unreliability, against her credibility. What she hadn't been told was that the defense would have the corrected record too, and that their strategy had therefore pivoted in the 2 weeks before her testimony to a different approach, not attacking her reliability, but attacking her motive. She was vindictive. She had a personal grievance. She was a woman who'd spent 4 years building resentment toward the people who disciplined her for legitimate failures. She sat in the witness box and answered every question with the same flatness she'd used in that supply corridor with Marcus Holt 8 months ago, when he'd asked her where she'd trained and she'd told him the truth without embellishment. She was not a compelling witness in the dramatic sense. She didn't perform emotion. She answered what was asked and stopped when the answer was complete. And the effect of this, she understood it from outside herself distantly, was that she was very difficult to rattle, which meant cross-examination was working against the defense rather than for them. The jury took 6 days to deliberate. Victor Mercer was convicted on 11 counts, including conspiracy to commit murder, the Mirabad soldiers, and violations of the Arms Export Control Act. Leonard Briggs was convicted on 9 counts. Raymond Grierson, who had cooperated and whose cooperation had been the foundation of the broader case, was convicted on 6 counts with a sentencing recommendation that reflected his assistance. The 2 other surviving names on the Mirabad authorization document were convicted in a separate proceeding 3 months later. The sentences were handed down on a Tuesday. She didn't attend. She read about them the same way she read about most things that happened at a distance, with careful attention and appropriate feeling, and then the discipline to set it down and continue the day. Mercer received 37 years without parole. He would die in custody. He was 63 years old, and his body already carried the evidence of a long life spent in high-stress environments, and 37 years was not a calculation that required mathematics. Briggs received 22 years. Grierson received 14 with the cooperation reduction, and would be out in 10, which was the number that sat worst in Hannah's chest if she let herself think about it. She didn't let herself think about it for long. 10 years in federal custody was not nothing, and the evidence Grierson had provided had dismantled 4 ongoing operations, generated 11 additional indictments across 2 other districts, and put names on a list that continued to produce consequences for people who had believed themselves to be past the reach of accountability. The families of the 8 soldiers were notified before the sentences were announced. Hannah knew this because Kowalski told her he'd been involved in the notification process, part of a liaison role between the investigation and the families that he'd apparently volunteered for and been doing quietly for months. He told her about the calls, briefly, without elaborating, because it wasn't the kind of thing that bore elaboration. 8 families who'd been told for years that their people had died because of a junior medic's failures. 8 families who now had the correct version of what had happened. She asked him if they'd been told about her specifically. "They were told you tried to stop it," he said, "that you filed the warnings and someone took them out of the record." He paused. "A few of them asked about you." She didn't ask what they'd asked. She didn't think she was ready for that yet. Dr. Owen Salas came back to work 6 weeks after the Vantage Care facility. His arm had required surgery. The fracture had been complicated by the angle of the injury and the delay in treatment, and he'd spent the intervening weeks in physical therapy and what he described when Hannah saw him in a coffee shop near the hospital, where he'd returned to work, as a fairly intensive reconsideration of several life choices. He looked better than she'd expected. He was the kind of man who processed difficulty by talking about it directly, which she found unexpectedly easy to work with. "I keep thinking about the fact that I just stopped at an accident," he said. "I was running late for dinner. I almost didn't stop." "I know," she said. "If I hadn't stopped, someone else would have," she said. "Or they wouldn't have, and Pierce would have died, and whatever happened after that would have been different." She looked at him. "But you stopped. And then you did your job. And then you wrote down what you saw, accurately." She paused. "That's the whole thing, really. Doing your job and writing down what you saw." He looked at her with an expression that she recognized, the same look she'd seen on faces in the ER, in the federal building corridor, in the parking garage. People recalibrating. "What are you doing now?" he asked. "Are you going back to Harwick?" She'd thought about it. She'd thought about it carefully, in the way she approached things she wasn't sure about, from multiple angles, with patience, waiting to see which direction felt like actual clarity, rather than just the end of waiting. "No," she said, "not Harwick." She told him what she was going to do instead, and he listened. And at the end of it, he nodded slowly with the look of someone hearing an answer that made complete sense and couldn't have been predicted. The Institute took 14 months to build from the first conversation with the grant committee to the first class of students. It was not a smooth 14 months. It never was. The grant process required documentation that took longer than it should have. The facility she'd identified in Colorado had zoning complications that required 3 separate hearings to resolve. And the curriculum she developed went through 7 drafts before it stopped feeling like something she'd written for an institution and started feeling like something she actually believed. She called it the Crestline Trauma Training Institute, after the ridge line visible from the facility's west-facing windows in Colorado Springs. It was functional in the way things are functional when built by someone who cares more about the work than the aesthetics. Clean, direct, without ornamentation. The equipment was current. The instructors she hired were people who'd done the work in real conditions, not just studied it. The curriculum was built around a principle she'd arrived at through 6 years of evidence rather than theory. That the gap between what people knew how to do and what they were prepared to do under real pressure was not a knowledge problem. It was a context problem. You could learn a procedure in a classroom and fail to execute it when the room was wrong, when the patient was the wrong color, when the sounds were the wrong sounds, when your hands were shaking because something had gone badly and there was no supervisor telling you what to do next. What she built was a program that closed that gap. Not perfectly. Nothing closed it perfectly, but practically. Nurses, paramedics, emergency responders, veterans transitioning to civilian medical roles. People who needed to be able to function when functioning was the hardest thing in the room. Pierce came to the opening. He flew in from Virginia, where he'd retired, moving with a careful deliberateness that reflected 8 months of physical therapy and a neck that would never be entirely comfortable again. He sat in the back of the first demonstration session and said nothing and left before the reception, which was exactly right. Kowalski came too. He was still active duty, which meant he'd had to navigate the bureaucracy of getting the time off, and he arrived slightly late in civilian clothes that looked like they'd been purchased specifically for the occasion and fitted by someone who'd done their best. He shook her hand at the end of the session with the particular awkwardness of a young man who wanted to say something significant and hadn't found the words. "This is good," he said finally. "It's a start," she said. "No." He looked at the room, the students filing out, the instructors talking in the corner, the equipment arranged with the utilitarian precision of a space built to be used rather than admired. "It's good. It's the right thing." He paused. "The families of the Mirabad soldiers, 2 of them reached out to me last month. They wanted to know if you were doing okay." She looked at him. "I told them you were building something," he said. She nodded. "Once." And then she had to look away for a moment because the room was full of people and full of purpose, and she was not, by any reasonable description, a woman who cried in front of an audience. But there were things that arrived without announcing themselves, and you either made room for them or you spent energy fighting something that didn't deserve the fight. She made room for it, just for a moment. Then she put it somewhere and went back to work. Lawson called on the 1-year anniversary of Mercer's conviction. Not for any particular reason. Hannah understood this from the first sentence, which was casual in a way that meant the call itself was the point, not the content of it. They talked for 20 minutes about things that weren't the case. Lawson mentioned she'd transferred to a position coordinating the broader Grierson-related prosecutions, which was either a promotion or a life sentence, depending on how you looked at it. Hannah mentioned that the second cohort of the Crestline program was 8 weeks in and that 2 of the students had already been recruited by a major hospital system in Denver that had heard about the curriculum. Near the end of the call, Lawson said, "Do you think about it much? The way it started? The hospital? The parking garage?" Hannah thought about this. "Sometimes," she said. "Less than I expected." "What do you think about when you think about it?" She considered the question honestly, the way she tried to consider everything, without the shortcuts that made hard things easier but less true. "I think about how long I spent trying to be invisible," she said. "How much energy went into making sure no one looked too closely. And then I think about the fact that the thing that brought everything down was someone looking closely at something I did." She paused. "The procedure in the trauma room. if I'd stayed invisible, if I'd stepped back when Holt stepped back, Pierce dies. None of the rest of it happens. You couldn't have stepped back, Lawson said. No, Hannah said. I couldn't. And that's the thing I keep coming back to. I'd built 4 years of a quiet life on the idea that staying small was the safest strategy. And the moment that actually mattered, staying small wasn't available to me. She looked out the window of her office at the Colorado Ridge in the distance, gray-green and unhurried under an overcast sky. I don't know if that's a lesson or just a thing that happened, but I think about it. Lawson was quiet for a moment. For what it's worth, she said, the way you operated through all of it, the burner phone, the test with Reyes, the bank records. I've worked with a lot of people in my career, and I've never seen anyone think that clearly under that kind of pressure. I had practice, Hannah said. The practice was expensive. Most real preparation is, Lawson said. They said goodbye without ceremony, the way people do when they know they'll talk again. Chip. The memorial was small. She'd requested small, 8 names on a stone panel in the Institute's entryway, with dates of service and nothing else. No elaboration, no explanation. People who came through the building would see them and either know the context or not, and if they asked, she would tell them. But the names didn't need elaboration to be what they were. She stood in front of it on the morning the panel was installed, before the students arrived, in the empty building with the Colorado light coming through the west windows and landing on the stone. Specialist James Ibarra, Sergeant Dana Kotek, Staff Sergeant Paul Vreeland, Corporal Terrence Osei, Specialist Rachel Monroe, Sergeant First Class Dwight Haynes, Corporal Ben Salcedo, Specialist Aya Nishino. She'd learned their names in 2019 and she'd carried them since, not as a punishment, not as penance, but as a fact. They'd existed, they'd served. They'd died in a building they'd been sent to on the basis of a lie, and the person who'd tried to prevent it had been erased from the record, and the people who'd constructed the lie had promoted each other and bought second homes and slept fine. That was the story for 4 years. Now the record said something different. Now 8 families knew what had actually happened and why, and who had tried to stop it. Now 4 men were in federal custody, and more were being processed, and the financial network that had funded the whole thing was being dismantled account by account in 3 federal districts. It wasn't enough. It was never going to be enough. Not in the way that made loss feel acceptable, because loss didn't become acceptable just because you established who was responsible for it. The 8 names on the stone were still 8 people who weren't alive. That was a permanent fact, and the legal and institutional consequences of what had happened to them, however thorough and however just, existed in a different category from the fact of their absence. But the truth was accurate now. The record was accurate, and accuracy was what she'd had to offer from the beginning. The accurate warnings, the accurate documentation, the accurate account of what she'd seen and what she'd tried to do. And the thing that had been done to her was the suppression of accuracy in the service of someone else's profit. She'd spent 4 years thinking that the lesson of Mirabad was that accurate and powerless was the same as invisible, that the truth only mattered if you had the standing to make people hear it. What she understood now, standing in front of 8 names on a stone panel in a building she'd built for the purpose of making people more capable in the moments that mattered most, was that she'd drawn the wrong conclusion. The truth had always mattered. It had mattered in 2019 when she filed the warnings that someone else removed. It had mattered in 2023 when she'd photographed documentation in a safe house bedroom at 2 in the morning. It had mattered every time she'd told the accurate version of events to another person who had the ability to act on it. She'd been right all along. She just hadn't had enough people around her who were paying attention. That was the thing she was trying to fix, not the past. You didn't fix the past. You accepted it as the price of arrival, but the forward-facing version of the problem. People who knew how to tell the truth clearly, who could hold the accurate account steady under pressure, who understood that the moment you started softening what you knew to make it more palatable to people who didn't want to hear it, you'd already lost something that couldn't be easily recovered. She taught this explicitly now. Not in those terms, not as philosophy, because philosophy in a trauma training curriculum was mostly useless, but in the specific, practical language of what to do when the room is wrong and the patient is crashing and every instinct you have is telling you that doing the correct thing is going to make someone in authority very uncomfortable. You do the correct thing. You document what you did and why. You don't apologize for the knowledge you have, and you don't pretend you don't have it to make the person next to you more comfortable. This was not a smooth or popular lesson. She'd had students push back on it, had had discussions that turned heated, had watched people sit with the discomfort of being told that competence was not a thing to perform modestly when lives were in the balance. She didn't soften it. She'd learned what softening it cost, and she wasn't willing to teach the lesson she'd unlearned. The students arrived at 8. She heard them in this corridor, voices, footsteps, the sounds of people coming into a space with purpose. She turned away from the stone panel and went to meet them, because that was the work, and the work was what she had, and it was, when she stood in front of it clearly, enough, more than enough. It was the thing she'd almost let them take from her, and she'd gotten it back in the hardest possible way, and she wasn't going to waste it by being small about it. She walked into the room. She began,